Hey guys, it's Toby Morrison here from CFS Health, and in today's video we're going to talk about why graded exercise therapy isn't helpful and why it doesn't work, and basically what does work instead. And we're going to really talk about when to move, when not to move. And I've done some deeper, longer videos on this topic, and I'll leave a link in the description where I talk about, is exercise bad for chronic fatigue syndrome and other chronic illnesses? So we'll help you out there. But one of the biggest problems with graded exercise therapy is that it has no flexibility. There's kind of two problems. I'm going to share with you on my trusty iPad, because this is a big issue that everyone faces basically when they're going through this experience, and it's really hard to navigate. And so I want to share with you kind of the reasons behind why it's not helpful and what to do instead. And this is what we teach in our program as well. So basically, they call it GET, which is graded exercise therapy. And basically it means that, what happened, let's say you've got chronic fatigue syndrome, you go to your physiotherapist and this is what they've been taught. And so they say to you, okay, Mary, we're going to find your, baseline level of what you can do. And they say, okay, great. So you can do a 10-minute walk today. And so because you can do that today, I want you to do that every single day, 7 times a week. Okay. And so basically, the program is, okay, Mary has to walk 10 minutes every single day, 7 days a week, regardless of how she feels. And then they say, okay, well, after, let's say, 2 weeks of that, then we're going to do 12 minutes every day. Okay. Or it could be even more, 15 minutes, whatever the person prescribes them. Now, this could be not just walking, this could be, strength stuff, so push-ups, all that kind of stuff. And there's 2 problems with this. The first problem is, they kind of start too high, as in they don't start from less, they start from more. And this is never a good thing, because you don't want to push your body when it's really trying to do its best to recover and heal. The second thing, and really we're going to make this the first, is there's no flexibility. Okay. And what I mean by that is I'm not talking about stretching flexibility, okay, although that can be useful. I'm talking about there's no flexibility within the programming. And so let's say Mary, does her 10-minute walk on Monday, but on Tuesday, she doesn't feel that good, right? And what's going to happen if she continued to do this 10-minute walk every single day? She starts here, she feels good, but then she gets back to here and she actually feels worse, okay? She feels worse here. And then she's been told that she's got to keep going. And every single day she's driving herself into a deficit. Okay. And this is what we call a energy deficit. Okay. And again, unfortunately, it's prescribed wrongly. That's really the problem here. And the reason why it's not helpful is because there is no flexibility. What would be better, and this is what we teach in our program, first of all, you need to know when to move and when not to move. So if there's some of you right now who shouldn't be focusing on movement at all. You need to be focusing on daily function. You need to be focusing on your daily routine and structure. You need to be focusing on your nutrition. You need to be focusing on restoring energy in your body. So rest and restorative movement, restorative breathing, calming down your nervous system. And then there's others that need to start moving and reconditioning because they can, but you shouldn't do too much. And so you want to make sure that you have flexibility, but you want to make sure that you know your baseline, right? And your baseline basically means that you can do things without feeling any worse than you currently do, right? And so this is why it's so important to have flexibility within your baseline, okay? So I'm going to share with you on the screen here what that looks like. Now, I've got an awesome free training that we've been sharing for a while now, and I'll leave the link below. It's called the Baseline Training. I would highly recommend you go through that yourself first. It's free. It's a really great, valuable training. It's about 25 minutes long, but I actually take you through an exercise, on the whiteboard to go through it and actually answer the question, so you'll figure it out yourself. Okay, that's the starting point. But basically, here's your baseline. Okay, and we're starting here, right? And what we want to do is we want to stay within our baseline here. Some days you're going to feel better, other days you're not going to feel as good. But what we want to do is have a consistent, steady progress on the incline, right? Now, if you push yourself too much and there's no flexibility and you do things despite you not feeling great that are beyond your capacity today, what happens is, right, you start to do these ones. Pushing, crashing, pushing, crashing, pushing, crashing. And so, like I said before, it's either usually wrongly prescribed, you start with too much, and there's no flexibility. So you need to learn to tune into your body. You need to learn what modality works for you. And this is what we'll talk about here, is really, that's a terrible square. Oh, if you saw this iPad, it's a little bit tricky. So here we have it, yeah? So basically, this is what we want. We want to choose the modality that is healthy and appropriate for us, okay? We don't want to choose something that is really ineffective or makes us feel worse, okay? So initially, this might be restorative movement, this might be restorative breathing, this might be mobility exercises versus pushing yourself or cardio stuff, yeah? So it really just depends on the person. So we want modality first, yeah? We want to start with less is more. And so basically what this means here is consistency over intensity. And once you get this right, it's unbelievable what can happen. Like, we have clients who literally start with absolutely nothing, and within 6 months, they're going on hikes again, they're feeling great, they're going on bike rides, and 12 months on, like we had one guy this literally the other day, a Gil messaged me. He worked with us for 12 months, and he messaged me the other day saying he went for a 12-hour hike and experienced no symptoms and felt great. He said he no symptoms, just felt joy. He's from Norway, and pretty cool to see. And it's because he built up appropriately and knows his body back to front, and obviously he's healthy now, so it's not a problem for him. But when he was going through that, he barely really left the house. So that's pretty cool. So we've got modality, we've got less is more. We want flexibility here. And that just basically means that we're tuning into our body. We know our sweet spot, but we're also adaptable. So let's say we don't sleep that well, or there's a bit of stress going on at home at the moment, then we usually back it off a little bit. We have a less is more approach to that, and then we build back into it, okay? And that's just really important. You don't want to just like rush into it and go from zero to hero overnight, okay? And then the fourth thing here is you want to progress appropriately. Now, it's easy, we help our clients with this every single day inside our program. So it's easier for them because they've got full trainings on everything, when to move, when not to move. There's a whole 30-minute training on modality, what to choose based off where you're at and what you want to focus on, what your goals are. And then we actually have pre-beginner, beginner, intermediate, advanced movement program, depending on where you're at. And then even before that, we help all our clients make sure that they've got their daily routine structure and baseline sorted before they even think about movement. So you can understand, you're understanding now that there's an actual plan here. It's not just like, guessing and leaving it up to chance. You want to make sure that you're doing the right things at the right time. So I hope this makes a lot of sense to you. And the reason most of the time why graded exercise therapy doesn't work is because it's wrongly prescribed. It's black and white, which isn't, you're not a robot. Okay. So it doesn't factor in sleep. It doesn't factor in stress levels. It doesn't factor in nutrition. Like all these things play a part. And so if someone's just being told to go and exercise for 20 minutes every day, regardless of how you feel, then I just think that's kind of not that safe and not that appropriate. And we start with the less is more approach initially, because that just means we can progress further faster, okay? Rather than trying to do too much too soon and then you just feel worse, we want to avoid that, okay? And you've got to kind of keep in mind the energy credits. So energy deficit versus energy credits, yeah? And we want to find the balance between the two, because we know that doing too much is not good, but we also know that doing too little isn't helpful either. And this is why you have to get your baseline. This is why you've got to lay the foundations down first, and then you can start to build, okay? So I'm just going to quickly wrap this up. I'm going to show you once more what we're talking about here. And this is, once you get this, honestly, like it's a game changer. And we've got clients who are as young as 15, 14, 13, and clients who are in their 70s and 80s, and all in between. We've got heaps of mums, heaps of dads, heaps of teenagers, heaps of sports people, heaps of academics, heaps of artists. And once you understand this for yourself, this whole section here, things just kind of work better, okay? It's like a harmonious cycle of functionality and progression. So choose your modality, what's appropriate for you right now. Just think the word appropriate basically is the key here. And you'll get feedback from your body too, okay? Then we go here, which is having a less is more approach, consistency over intensity. We're having flexibility within our baseline, so we know what to do on the not so good days, but we also know what to do on our good days, okay? And that way you just know what you're doing. And so you have a plan and you wake up and you just stick to the plan. And when you're consistent with it, you start getting results. And then you need to know when to progress appropriately. And, again, there's a little bit of an art to that. And this isn't just progressing with your physicality, it's progressing with your cognitive levels too, of what you're doing with your brain every single day. So to recap, like I said, graded exercise therapy, unfortunately, is wrongly prescribed most of the time. And the other thing is, you're in charge of your body. Like, no one knows your body better than you. The amount of times that I've heard, members who come to us after seeing so many different people and like saying that they were pushed so hard and that, their last, and this is not to downgrade physios or physiotherapists or anyone, actually. Like, there's some brilliant people out there helping a lot of people, but unfortunately there's just so many stories of people not knowing their patients' bodies, and they're pushing them way beyond their current capacity. And so you should be the one in charge of the decisions, not anyone outside of you, because your body, your body better than anyone else, okay? Because I've been through chronic fatigue syndrome myself, and because all our coaches have been through it too and gotten better, we have a deeper understanding and knowledge of what someone's going through with chronic fatigue syndrome. We get their bodies, we understand it better. So it's a lot easier for us to prescribe and not prescribe based off depending on where you're at, okay? And this is why, when I started helping people, like, 13, 14 years ago, one-on-one, before online was even a thing, I followed this protocol. Like, I literally followed this protocol, and it worked every time. Like, it just works because it's a framework and it's proven. And when you stick to it and, you do it over time, you eventually get healthier. and stronger without depleting your energy stores. And, you know, because I went through it myself, I was better at making a decision for my clients than they were themselves at the beginning, because they just had no idea. Now, luckily, we have all these frameworks inside our online recovery program, which we teach, and there's hours and hours of training on this stuff. Okay. So again, we want to avoid the ups and downs. Yeah. So none of this. Stop thinking 0 to hero every day. Okay. That doesn't work. We want consistency over intensity. And what happens over time is you get a nice, see how that's kind of going on an upward trajectory. That's progress. Okay. And that's what we want to be focusing on here. But just keep in mind that you need a holistic approach. It's not just one thing, you know. And this is why it's so important that you do have a holistic approach with your recovery. You know, you're not just trying one thing, you're just doing instead you're focusing on everything that you know is going to move the needle for you, that's going to improve your overall health and well-being, and make sure that you do things appropriately and progress appropriately. Okay. And there's so many videos on here. This is literally scratching the surface. So hopefully you understand the confusion behind graded exercise therapy and why typically it makes people feel worse. And hopefully now you understand instead what the real focus is on here. And you have to remember that some of you just shouldn't be moving right now. Like, it's just the last thing you should be focusing on, especially if you're, you know, fully compromised, your immune system's totally shot, you're not sleeping at all, or your sleep's totally out of whack. We need to get things back in order. Once you get things back in order, then you can start to move in towards this stuff. But until you've got a foundation, until you have a baseline, you know, you're kind of just shooting in the dark. And so, you know, there's a step-by-step process that you need to follow. But hopefully this is a good enough example for you to understand and make sense of kind of what's going on for you. So don't feel disheartened if you've gone backwards. Don't feel disheartened if you keep going up and down. Hopefully now that you understand the concept a bit better, you can apply it more in your life. I'll leave 2 videos for you, one on a way deeper conversation around exercise and chronic illness. That's really, really valuable. It's had thousands of views. Go watch that one, because I think that'll help you if this is of interest of you. And then if you want to learn how to create your own baseline, like I said, I've got a free training. It's about 25 minutes long. We'll send it to your email inbox so you can watch it in replay as well. Watch that. And then if you want to work with us and you want us to help you with the plan, and you actually want a step-by-step process and a program to follow and help and accountability every step of the way, then reach out and apply for the program, because it's hard doing it on your own. And, you know, it's so much easier when you're supported, when you've got accountability, and when you're getting the right help on a multifaceted, holistic approach. And it just takes all the guesswork out for you, and makes it a lot more enjoyable, and you know, gives you hope and inspiration, because you're surrounded by like-minded people in almost every country in the world, basically. We've got amazing members from all over the world, and you get to see them, you know, move forwards with their recovery, and you can encourage each other. And, you know, we've got, like I said, you know, Gil from Norway just messaged me the other day with a beautiful video of him hiking in Norway. You know, another one who's just written a book recently, another one who's just started full-time work again, another one who's just started her own business, another one who's just fallen pregnant when she was told that she wasn't going to be able to fall pregnant. So all these amazing wins, and just provide so much hope and inspiration and positivity. So if you want that, apply for the program. We'll send you an email with all the information you need to know about it. Or you can go to our website, cfshealth.com. I'll leave the free trainings below, and we'll speak to you soon. Hope this video is helpful. If you found it helpful, give it a thumbs up, please. Leave a comment just to let us know it was helpful, and subscribe, because we've got so many great videos on this channel that can help you move forwards with your health and your life. All the best. Speak to you soon.